So I'm a computer scientist. I'm also an interaction designer. What I want to talk to you about today is how to leverage interaction, not just to make systems more usable from a healthcare perspective, but actually how to leverage interaction data as a source of data for healthcare. But before I get there, let me talk about something that you all really understand already, which is we're in the midst of an amazing technological revolution, right? You can see vast amounts of sensors. In the top left, you see sensors that were really only accessible to researchers and scientists. How they've progressed to the sensors on the right-hand side, which are, my children can use because they're based out of Lego parts, all the way down to what we can buy today for $100 a pop, consumer-level technology that's really usable and really quite effective in collecting basic data about our everyday behaviors. Similarly, we've seen a big change in what's available from the mobile side, right? We no longer have these mobile phones, our car phones that are this big and you had to have a briefcase to carry them, and we see things that are much smaller. One of the really nice advantages of having this sort of plethora of mobile devices is that these devices not only provide us information as a way to, these devices not only provide us a really nice way to collect data about individuals as they go throughout their everyday life, but they provide really nice tools for visualizing that data, for providing feedback about that data. Now, I was at an NSF-NIH meeting last week in Washington, D.C., and someone from the National Science Foundation said there were approximately 15,000 health-related applications on the Apple App Store. One of the issues I have with many of these applications that are out there is that they really are very good at collecting data, mostly self-reported data, and presenting you that raw data. But what they don't do is help you convert that data to useful information. So this is one of my favorite graphics, where it really, I think, illustrates the point of how the challenges that need to be overcome in order to convert data to information, to knowledge, so that you can take action on it. And I think that's where the users of the technologies that we produce really have a struggle with. And I think we've heard a lot about that over the past day and a half. One of the issues that we have to face are to convert data to information is how to value context. So contextual information is really important for understanding the data that's being collected. We have to support users in being able to create questions about their data, scaffold them in being able to form hypotheses and prove and disprove these hypotheses. And that's one of the things my group at Carnegie Mellon is focusing on, where we're looking at how to collect large amounts of data about individuals, mostly about the routines and about their human behaviors, their routines and behaviors, and leverage that data to improve their healthcare situation. So in moving from what we want as a healthy individual to the topic of my talk, which is a healthy home, I think there's a number of things we need to start looking at. The first is, how can we leverage everyday activities? Right? So the everyday activities you see in the slide are taking medicine, doing the laundry, reading the newspaper, reading a book, balancing your checkbook. These are all instrumental activities of daily living, sort of core activities that someone would perform in their home. And I think that these kinds of activities really stand apart from a lot of the technologies we've seen previously in this conference. So there's been a lot of focus on a device that I'll go and buy from the store, like a Fitbit or a Zeo or something like that, and use it and wear it very explicitly. Similarly, we've seen technology that you would find in a clinician's office that when you go in to see your clinician, the clinician would pull it out, put it on you, collect some data from you, and then you'd move on. The kind of data I'm really interested in is the kind of data that you can collect when people are just performing their everyday activities. So I want to introduce you to DwellSense. DwellSense is the product of several years' worth of work. It was the culmination of my PhD student, Matthew Lee's PhD thesis. Matthew is now left CMU. He's a researcher at Phillips Research. And this is work that was sponsored by the Robert Wood Johnson Foundation Pioneer Portfolio, as well as the National Science Foundation. DwellSense is the technology that I'm talking about. It's an example of the technology I'm talking about. Could we go back one slide, please? Can we go back one slide, please? Thank you. So this technology, I think trigger happy here. This technology is really looking at how can we collect information about everyday behavior by instrumenting the artifacts that people interact with on an everyday behavior. So we have things like a pill box, right? This is basically a $5 pill box, seven-day pill box that you can buy from Rite Aid. Well, it's actually two. They're just super glued back to back. So on one side, as you can see in the image, there's batteries and there's sensors and there's hardware all in here. But on the other side, it's basically a regular pill box, right? And so what kind of information can we collect with this? We're really interested in collecting two kinds of information, or data with two particular characteristics. This data setup is really meant to help us understand and assess cognitive decline in elders, in seniors. So how can we instrument their everyday activities, instrument the artifacts they use on an everyday basis to be able to collect information about cognitive decline? The second thing that we're really interested in is how to do it in a way that doesn't affect how they perform those activities. So we took 3 of those instrumental activities of daily living, ones that we thought we could sense relatively easily, and ones that, where they provided some concrete value to our subjects, to our users. And so the key thing behind the technology, because there's plenty of pill boxes out there that will tell you whether someone's been successful at taking their medicine. There's the pill bottles, there's other things that look like this that collect information about whether you're successful. And we care a little bit less about whether you were successful or not than about the quality of your performance. So one of the things you notice if you have an elderly parent or a loved one that's undergoing cognitive decline is that the decline, the change in the performance actually occurs much earlier than you see them making mistakes, right? Someone can be perfectly successful at taking their medicine, but the quality of the performance of taking that medicine may be exhibited long before they start having problems. So let me give you a concrete example. So you may have a parent that is having difficulty remembering what day of the week it is, right? So there's sensors on here that can basically tell you, okay, they opened Sunday, they opened Monday, and now they've opened Tuesday, which is today. Right? So they got it right. They've successfully taken their medicine, but what the system is able to capture is how well the performance of that activity was. So there's lots of sensors in here. There's things to let us know when the door has been opened. There's accelerometers in here to let you know when it's been turned over. There's sensors in here to let us know when they're having physical difficulty, as I am right now, in opening this box. Similarly, we instrumented telephone, which it'll catch up soon, I hope. Can we move to the next slide? All right, well, I'll just keep talking. So we instrumented a telephone to let us know when people are making phone calls, and particularly we're interested in the quality of missed dials. Okay, now we've jumped ahead. And then we've instrumented a coffee maker. So a coffee maker is a really good example of a multi-step process. Making coffee is an example of a multi-step process where you can do some of the steps in not quite the right order and still get a cup of coffee. But we want to know, did our users put the coffee filter in? So we have sensors to know when they got water, when they put the carafe into the coffee maker, when they put water into the reservoir. So we can sense all of these different steps of the process to understand what their performance is with these activities of daily living. The architecture is basically this. We have the sensors instrumented, these artifacts instrumented throughout someone's environment. We wirelessly transmit it all to a laptop, and then from the laptop we use the internet and internet access to be able to do some cloud-based analytics, which allow us to do things like produce web-based graphs primarily and a real-time feedback display. So we instrumented this in 14, sorry, go back one slide, please. We instrumented this in 14 homes of seniors, and you can see these are pretty messy environments. These are not clean environments. These are not laboratory studies. Some of our subjects would spill their nail polish over it. They eat over these devices, and you can see highlighted the laptop behind the TV and the pill box in the living room. So these were pretty messy environments. And we were lucky that when the technology lasted 2 weeks at a time, so we were kind of replacing these. We deliberately under-engineered the system so that we could get reliable data, but we paid the cost of going out and replacing batteries and replacing the system. So we put this into 14 of seniors' homes. And then we provided a display on a tablet just like this. Let me see if I can turn this on. And basically the tablet gives them a real-time feedback about what the system is doing, what the system is collecting about them. So on the top left, you can see that there's a green circle around the AM medicine. So this was tracking morning medicine and afternoon medicine for this, or evening medicine for this individual. And you can see they took the medicine on time at 6:20. But you can see that the Sunday and Monday tabs of the pill box are lit in yellow, which means they opened the Sunday and Monday, and then they correctly opened the green Tuesday. They did not take their evening medicine. And from that, we used a bunch of heuristics, a series of heuristics that we developed over time, to give them scores on the correctness of the activity as well as the timeliness of this activity. So you can see those in the bars to the right. Similarly, we have this kind of data for making phone calls as well as for the coffee-making task. And for the coffee-making task, we break it up into a series of steps that correspond to the sensors that we have in our system. One of the things this really allowed us to do was the display helped reorient our users to better understand how well they were performing these activities.
Before, did you think you were doing it regularly?
Yeah, absolutely. I would have bet my life that I didn't miss any days, because that's one of the things about getting old. You actually physically say, no, that couldn't be. I know I took it today. And you didn't. I hate to know that. I hate to acknowledge that, because it's just another thing that you don't like happening. This surely does show you what you're doing wrong.
So our subjects had the ability, by reflecting on this data on an everyday basis, to really see how well they were performing these activities. Not just whether they were successful or not, but actually how well they were performing these activities. So one of the things we can see here in this graph is that we, just looking at medication adherence, just looking at the display actually improved medication adherence. So this is a really crude graph where green dots, so you got a timeline across the bottom. These are two different subjects. On the green dots mean that they took the pill on time, yellow meant that they took their pill late, and red means they forgot their pill. So before we introduced the display, you can see there's a fair amount of noise in terms of how successful they were at this task. But then after we introduce the display, there's this really nice regularity that happens, particularly for the top subjects, but even for the bottom subject. You can see that for at least October and November, they didn't miss any medication, and they weren't late on any of their medication as well. So without this tablet device acting as a reminder system, with it actually acting as a way to allow users to reflect on the performance of their behavior, they actually improved the performance of their behavior, which was for us was a really nice finding. A second thing that we saw was in terms of real-time versus long-term displays. So half of the elders in our study, we gave them the real-time display, and the other half we didn't show them any data. We collected data for 4 months, and we said, okay, after 4 months, look at this data and tell us what you think. And it was really quite interesting what we found. It really served to shock them into reality. So they thought that they were performing well, as you heard in the quote before, but then after seeing 4 months of data, they realized just how poorly they were performing on some of these activities, like making coffee, taking medicine, and making misdials with their phone. The good thing is that that shock had a really nice impact of improving their behavior. The negative thing is it only tended to last on average 3 to 4 weeks. So the long-term display was really effective, but the effect of it was quite short-lived, unfortunately. So what I've talked about so far is how this kind of technology helps reorient individuals so they're more aware of their behavior, as well as how it helps them perform better in these behaviors. The thing that I think that's most appealing to me about this technology that we've been developing, that others are similarly developing, is that it can be used as an early assessment of cognitive decline. And so here we brought in occupational therapists to come in and do regular assessments similar to the tasks that we had people perform. Now, an occupational therapist might see somebody once every 6 months and have them perform some fairly artificial tasks. So the nice thing about the technology is what you see on the screen. It's automated, it's objective, it's cheap, it's frequently repeated, it's continuous assessment. And not only do we want it to provide assistance to occupational therapists, but we also think this data would be relatively useful for clinicians. So look at this diagram, or this graph for one individual, subject 14 in our study. This person was doing pretty well through August through November. But then in January, the patient had a bad fall, was hospitalized, and due to complications passed away pretty quickly. Now, one of the things we noticed in retrospect when we looked back at the data is that in November and December, just looking at the medication adherence perspective, there's a lot of missing pills. Now, we're not saying that a clinician would have noticed this or that the clinician would have even asked for this data, but the data was there, and I think this just goes to illustrate how valuable this kind of data can be in the clinical care practice. So dwell stents can support greater awareness of tasks. It can improve this medication adherence, which is obviously a really important problem. It can help find these early indicators of cognitive decline and adverse events. And similarly, it can provide assistance to occupational therapists. And our goal is hopefully to provide value in the physician's office, which is something we have to show next. Thank you very much.